We are on a mission to help nurses integrate into this industry, and we really feel like cannabis has a capacity to be the catalyst for a healthcare revolution. And so we need cannabis nurses that are knowledgeable, that can teach patients, that can, be a good resource and a reputable resource for them, and be science-based and break the stigmas and educate patients and empower them. And, one of the things I focus on personally is helping patients find medical quality cannabis, because there's a lot out there that's not. And so we really are patient-focused, and, we see in this industry there are some people that are going kind of the pharmaceutical route, and we feel like if we become profit-focused, then those patients are going to fall through the cracks. So we are really going to be that patient center that is advocating for their best good. I was an acute care nurse until 2012, and I was working in a hospital and doing critical care nursing, and cannabis was not on my radar at all. And I became very ill. And, about a year into my illness journey, I had a complete health collapse. I was 20 pounds lighter than I am today. I had multi-system organ failure. I had chronic severe pain, brain fog. And cannabis actually got rid of all of those symptoms for me, and also kept me off of opioids, which as a nurse, that was my reason for starting cannabis, was to not go down that opioid route. And so it not only managed my pain, but it's also gone on to help improve my overall health and function. And today, about 7 years later, my autoimmune markers are actually reversed, which is unheard of with the mainstream approach. And so this is just, something that patients need to understand, that there's a safe and effective alternative to pharmaceuticals, and, and really break through that stigma. And so when they hear these stories, they begin to understand that there might be a better choice for them. One of the things that we teach really widely, and it's actually, if you go to my website, Integrated Holistic Care, under our FAQ section, there's a patient self-questionnaire. And these are asking about considerations of cannabis therapy and helping patients understand when they should seek medical oversight of their cannabis therapy. Things like pharmaceutical interactions or certain conditions that might need specific components and stay away from others. With CBD being so readily available now, you can buy it at a gas station, or college campuses. We want patients who are really seeking it for medicine to understand that there's a specific route to do so, and not just to go out and start combining CBD with things like warfarin, which can cause big problems. So we want patients to understand, even though anybody can get it and it's, very popular, that there might be reasons why you should seek a knowledgeable medical professional before you start cannabis therapy. The endocannabinoid system is our body's master system that promotes homeostasis or balance in our body. And when you consider, from a broad view, the underlying cause of every chronic illness is imbalances. So whether people are taking cannabis and they think it's a recreational use, or if they're really targeting medical use, they're getting some medical benefits from that. A lot of people are self-medicating with cannabis. But cannabis, with the correct formulations, can really target those underlying imbalances and actually reduce the cause of chronic illnesses, versus, most pharmaceuticals cannot claim that same thing. I think the only one we can consider curative would be like antibiotics. And so it's a very different paradigm. And it's a challenge in this medical system, because we're so used to that pharmaceutical being the go-to. So we're trying to really teach that there might be a better first resort for a lot of these patients, because the pharma route for chronic illness really, you just end up having to take more and more medications. And with cannabis, we're actually seeing patients reduce their reliance on pharmaceuticals and improve their quality of life and function. Well, thank you, everybody. I appreciate you watching. Thanks.
As a trained pediatrician, I was working in pediatric emergency medicine for many years. I became a mom, and it became very difficult to be superwoman and do both things really well. And so I had switched to working graveyard shift exclusively, and I found that to be very difficult. So I took some time off from work. And during that time, a friend of mine was ill and asked me about medical cannabis, and I didn't know anything. So I decided to do some research for my friend, and I could not believe what I was reading in the scientific literature. Blew me away. And so when I decided to go back to medicine, I decided to go back to start up a medical practice in this field of medical cannabis instead of the ER. I've been doing this now for 11 years, and because of my pediatric background, I take care mostly of children now. Children suffering with epilepsy, autism, cancer, ADHD, all kinds of really challenging medical conditions. And it's been incredibly rewarding because we're seeing some wonderful results. I think when you have a sick child, anything safe should be on the table. Parents should have options. We have to remember that these are developing humans. Their brain is going through a huge change from birth until adulthood. And many of the pharmaceuticals that are being used for cancer, for epilepsy, even for autism, can be very damaging and can have a lot of side effects. In fact, the vast majority of patients that end up in my office are patients seeking a more natural, non-toxic, no side effect approach. And it's not to say that cannabis doesn't have potential for side effects, but under medical supervision in children, what I have found is it's very safe. We can minimize and mitigate side effects by changing dosing, changing timing of dosing, changing the different phytocannabinoids that we use. Lots of different things that we can do to mitigate side effects. When I have successfully treated a patient, I will share with you that the parents will tell you there are no side effects. And what we are seeing is improvement in our child's quality of life. And also what we're seeing is our child's cognitive function moving forward. I think a lot of people think that, we all have that idea of someone who's a stoner and so on. This is worlds away from the medical use of cannabis and what I'm doing with my pediatric patients. So the discovery of the endocannabinoid system in the late 1980s, early 1990s opened up a huge area of interest, and it's a target for treatment. The endocannabinoid system exists to help us maintain balance of the internal environment despite external stressors. And so by manipulating the endocannabinoid system using phytocannabinoids, compounds from the plant that mimic endocannabinoid compounds, what we're finding is that we can take patients who are not in a homeostatic place or not in balance and get them back into balance. So I'm grateful for the cannabis plant in the multitude of ways that its compounds can change the quality of life for people who are struggling and suffering with medical conditions.
The use of cannabis to promote health and to prevent disease, because we so often talk about cannabis as a solution to conditions that are already pretty far along, and often conditions that don't respond very well to conventional treatments. And cannabis so frequently comes in and either helps a little bit or maybe it helps miraculously, but it has power in many areas of medicine, very diverse applicability in medicine. And to me, that begs the question, well, if it can work so well for treating complex chronic disease and advanced disease, what could it do to prevent illness, to keep people healthy, and to maybe mitigate some of the harm of our common conditions like heart attack and stroke, other types of brain injury. And the message is, I believe there is a way to use cannabis to stay healthy. For healthy people that aren't sick, can use cannabis to mitigate stress, to promote sleep, to reduce inflammation, to enhance connectivity with oneself and with others. I mean, there's many ways that we can use cannabis as a healthy support in our lives. We have many things to learn about using cannabis in children. It's very clear that for children with severe medical conditions, cannabis is a less harmful and often more effective solution to treat their symptoms than some of the conventional. So in those situations, which is where I tend to see children clinically, they come to me when they're pretty sick. And we look at some of their other options and we look at cannabis and we say, well, cannabis is clearly a better choice. And often it works at very low doses in children, and often children tolerate it better than adults. They have less side effects, almost always. So then the other really important question is, well, many of our children that are healthy or mostly healthy that are living in a very challenging and toxic environment that we all share here. What can we do to keep them healthy, or could cannabis be used in healthy children as like a first aid remedy or as a replacement for things like acetaminophen or other over-the-counter drugs? And I think that's a great question. We don't really have an answer for that yet, but I certainly have some opinions that cannabis is less toxic and probably more effective than many of the other treatments that pediatricians are very comfortable with. I traveled from Maine through Washington, D.C. to Oregon. These are all places where cannabis is totally legal for adults to possess. I started my career in cannabis activism 20 years ago when that was not the case. And so I can look around and say, wow, we really have changed things. The world is changing, and cannabis is legal. Less people are going to jail for it. And it's making its way into the hearts and minds of more and more diverse groups of people all around the world. And I think that's just going to make the world a safer, better, more loving place.
My name is Tracy Ryan. I am the founder of Cannakids and also the nonprofit SavingSophie.org. And we're also pioneering a new pharmaceutical endeavor called Integr8. Our goal is to make sure that patients are able to get medicine that we believe can really help them on very difficult journeys. Cancer, autism, epilepsy, PTSD, Crohn's, fibromyalgia, MS. This plant is a really wonderful tool that everyone should have in their tool belt when they are facing or battling some sort of issue. Now, our goal has really always been to make sure that kids are thought about. There's so little research going on pediatric disease in the United States, and that's why we're Cannakids. Not only because my daughter has inspired this company since she was born with a low-grade brain tumor diagnosed at 8.5 months old, now over 6 years ago, but also just looking at what's happening in medicine across the board. Take cancer, for example. Only 3.8% of all government funding actually goes to pediatric cancer research. So children like my daughter Sophie are on drugs that are 30 years old, and we didn't have cell phones 30 years ago, so think about that. It's really sad that only 3 new drugs have come to market, so we hope that through our research that we're doing currently, patents that we're about to publish on cancer, we're going to have some really hard-founded evidence that we're extremely excited to eventually share with the public. We've been studying 14 of our patients in all different ages and all different varying stages of disease, and what we are finding that this plant is doing to the immune system is absolutely remarkable. And now we're going to have the proof. So not only do we want to continue to support patients on a state-to-state level and soon a national level with our Cannakids line of medicinal oils, but we also want to bring the research forward so people can stop questioning once and for all how therapeutic this plant actually is. So for parents, it's really about education a lot of times because people can be very scared of THC. CBD is becoming much more widely accepted, but there shouldn't be fear, in my opinion, around the THC plant. Take THCA, for example. It's an acid. It's like juicing the raw plant. We do a low-heat olive oil soak with beautiful, rich cannabinoid and terpenoid flower, and that THCA is helping children immensely, specifically in the areas of autism, ADD, ADHD, and ODD, which is oppositional defiance disorder. These kids are... What I'm seeing with my own eyes is so exciting because they're getting off their pharmaceuticals. They're not having all this violent rage anymore. We're seeing children speak for the first time. And these parents are getting out there now and telling these stories, which is even more exciting. Pharmaceuticals absolutely have a place in medicine. And I would never say that we need to get rid of all these pharmaceuticals, but there are a lot of pharmaceuticals that make you worse and not necessarily better. And there are pharmaceuticals that can help your condition, but they can cause other conditions to then pop up, which you have to use other pharmaceuticals for. And in our personal experience and in our observational studies, we're not seeing that. We're seeing people actually need no pharmaceuticals in a lot of situations or reduce their pharmaceuticals down to a point where there's much lower toxicity.